You can tell a whole lot about a nation's well-being just by looking at the health of its mothers and children. It's a fundamental measure of how we're all doing. But how do we actually improve it? How do we take all this data and turn it into lives saved? Well, that's exactly what we're going to break down in this explainer.
All right, here's our game plan. We're going to start by setting the stakes, why this is so important. Then we'll peek inside what I like to call the public health detective kit. After that, we'll hear some amazing stories from the field, look at what the hard evidence tells us, and finally, cast our eyes to the future of this absolutely vital work.
So, first things first, why the urgency? Before we get into the how, we really need to understand the scale of the challenge we're facing. This is a challenge that literally defines the health and the future of entire communities around the globe. To really wrap your head around this, just look at this number, 273. Back in 2012, in just one region of Guatemala, 273 mothers died for every 100,000 babies born. Now, that's not just a statistic on a slide, it's a crisis. It's a call to action, and it gives our investigation a very clear and very urgent starting point. And look, if you're going to fight a problem this massive, you have to define it first. This is the official definition health investigators use, and it's absolutely critical. It creates a consistent benchmark, a shared language that lets them compare what's happening in different places and see if they're making progress. Every single word in this definition matters. Okay, so that's the problem. But how do you even begin to investigate it? Well, this is where we open up the toolkit. We're about to see how these public health detectives on the ground use data and specific methods to figure out what's really going on, and, most importantly, why. It all starts with information. Every good detective needs sources, right? And these are some of the heavy hitters. You've got demographic and health surveys. Think of those as the big 30,000-foot view of a population. Mortality surveillance tracks deaths to spot dangerous patterns. Birth defect systems keep an eye on congenital conditions. Violence against children surveys help uncover hidden risks. And health facility assessments, well, they tell you if the clinics are even equipped to help. Each one is a crucial piece of the puzzle. But here's a massive puzzle. What do you do in places where there are no doctors? I mean, in so many of the world's most vulnerable areas, deaths happen at home, miles and miles away from any medical facility. So how on earth do you figure out what actually happened? The answer is pretty incredible, actually. It's something called a verbal autopsy. Trained investigators sit down with family members and, through a really careful and structured interview, they piece together the story of that person's final days and weeks. It's like being a medical detective without a lab. And a key study out of Uganda showed that when it's done right, this method can be a highly reliable way to understand causes of death, especially for kids. So to put it all together, think of these methods like different camera lenses. The household surveys, that's your wide-angle shot. It gives you the whole landscape. Surveillance systems, they're like your zoom lens, focusing in on specific threats, like an outbreak. And hospital records, that's the super detailed close-up shot, showing you exactly what happened once someone got to the clinic. Okay, enough about the toolkit. Let's see the stuff in action. We're going to dive into 3 quick stories from the field that show how all this detective work is literally saving lives. So for our first story, we're heading back to Guatemala. Remember that heartbreaking mortality rate we saw earlier? Well, this part of the story starts with a simple but really powerful question about a piece of technology most of us just take for granted. The answer was a resounding yes, thanks to a system called Tula Salute. The idea was genius in its simplicity. They gave basic cell phones to trained community volunteers. These volunteers could then send text messages with clinical updates on pregnant women in their village, get advice from doctors remotely, and, this is the most critical part, coordinate an emergency transfer to a hospital when complications came up. That simple phone became a digital lifeline. And the impact? It was absolutely massive. The study found a huge, statistically significant drop in both maternal and child deaths in the communities using this mHealth system. It was incredible proof that simple, accessible technology could bridge that deadly gap between a remote village and life-saving care. Okay, for our next story, we're off to Costa Rica. And this one isn't about fancy tech. It's about a smart, nationwide policy. In 1997, the government made a crucial decision. They required that staple foods like flour be fortified with folic acid, a nutrient that is key to preventing certain birth defects. The result of this one policy change was just wow. By 2009, infant deaths from neural tube defects had plummeted by an incredible 71%. 71%!
This is such a powerful example of a preventative, population-wide intervention that saved a generation of children before they were even born.
And for our last story, let's head to India. Researchers there were investigating childhood stunting. That's a form of malnutrition that has lifelong consequences. And when they dug into the data, they found something profound. The 5 biggest risk factors weren't just medical. They were deeply tied to the mother's health and her social circumstances. Her own height, her education level, her family's wealth. Together, these things accounted for over 2/3 of the risk. So when you take these stories from Guatemala, Costa Rica, and India, and you put them all side by side, you start to see it, right? A pattern starts to emerge. You can begin to see a blueprint for what really, truly works in maternal and child health. And this table basically pulls it all together. The evidence is crystal clear. A study in Mozambique found that when you invest in more health workers, mortality drops. We saw in Costa Rica that when you improve nutrition on a national scale, you get dramatic results. In Guatemala, we saw that when you use technology to connect communities, you save mothers. And, as seen again in Mozambique, when governments increase their health financing, fewer children die. It's not a mystery.
Okay, all this evidence is powerful stuff. But it brings us to our final section. What does this all mean for the future? Where do we go from here?
You know, this quote from that Mozambique study just nails it. The path forward isn't just about the interventions themselves. It's about information. We need better data systems so we can find the gaps, so we can see which communities are thriving and, more importantly, which ones are being left behind. That's how we can target our resources where they are needed most. Ultimately, what this all shows is that we have a playbook. We have the detective tools, we have the data, and we have evidence-backed strategies that we know can make a massive difference in the health of mothers and children. The methods work. So the real question it leaves us with is this. Knowing what we know, and with these proven tools in hand, where do we apply this life-saving knowledge next?